Hi guys, my name is Cindy Tong and today my topic is Black Plague. First, I will talk about the background knowledge of Black Plague. The Black Plague could also be called the bubonic plague. Bubonic plague is spread by fleas on rodents and handling infected animals. The defect is caused by pickup and mutation. It is a type of infection caused by Yersinia pestis bacterium, which I will explain later. The most well-known bubonic plague is called the Black Death. It started in 1346 and originated in China. By trade route, the plague spread throughout Europe and killed more than 20 million people. Next, I'm going to explain the history of the Black Plague. A few questions follows it. First question: what treatments or cures were used by people in the Middle Age during the Black Plague? Second question: which area was affected by the Black Death? Does Black Plague still exist now? Last question: how does the Black Plague end in the medieval bubonic plague? For the first question, medieval cures for Black Death. The people in medieval have used many ways to treat the Black Plague. In that period, medical development were not that advanced yet, so people were trying everything they could think of, hoping that might cure the disease. The treatment includes animal cures, potions, fumigation, bloodletting, flight from infected area, religious care, and quarantine social distancing. People took this strange method and most of them doesn't work. And that leads to the question, how does the Black Plague end? What method does they use that actually does work? The Black Plague ended in 1352. The working method includes quarantine, cremation of the dead, and improving sanitation. The Black Plague ended may also because they were running out of victims to kill. Last question: which area was affected by the Black Plague, and does it still exist now? The graph shows different colored region and the time the Black Plague had arrived and the trade route. From the graph, we could visually see most of the Europe were affected by the Black Plague. Since the end of the plague in 1352, the Black Plague still exists. From this graph, human plague cases in the United States between 1900 to 2012, 80% were bubonic plague. Even though the plague still exists, now we have better treatment, which makes the disease less severe than the plague happened in the medieval. Next, I'm going to talk about what causes the Black Plague. Yersinia pestis is the cause of bubonic plague. It follows by a few questions. First question: what is Yersinia pestis? Y. pestis is a bacterium instead of virus. It is a gram-negative that causes plague. Y. pestis is a disease of rodents and fleas. Second question: in our body, what has been disrupted by Y. pestis? This question is related to what's in Y. pestis affect the body system. Y. pestis contains a particular molecule T3SS, which stands for type 3 secretion system. The T3SS in Y. pestis injects a set of effector proteins known as YAPs. The outer protein YAPs targets the cytoskeleton, pro-inflammatory signaling pathway, and other cell functions. By the protein YAPs in Y. pestis, the pathogen can suppress the inflammatory response to infection. The Y. pestis stop the body from fighting back the infection. As a result, It causes people to contract the disease. Third question. What is the key strategy of white pestis? The key strategy of white pestis is to prevent the production of active IL-1 beta and IL-18 through YAP's apparent combination of activity. Last question. What makes white pestis so deadly? This question is related to the mutation of white pestis. Yersinia pestis evolved from Y. pseudotuberculosis. White pestis ancestors Y. pseudotuberculosis, which can only cause illness like scarlet fever. People can recover from it after a few weeks. But the plague caused by Yersinia pestis is far more deadly. The reason why white pestis become more deadly is because of two key mutations. The first mutation allows the bacterium to create a protein which makes it more deadly. The second mutation allows the bacterium to enter deeper into human body and leap easily on an infected fleas. Symptoms of Black Plague. The symptom of Black Plague includes fever, headache, chills, weakness, vomiting, muscle pain, and nausea. After these early signs, it follows by blackened tissues, swollen painful lymph nodes, buboes, which gave it its name bubonic plague. When I think of the symptom of infected patients, I wonder what would happen if pregnant women get infected the bubonic plague. And I did some research. I found plague during pregnancy can lead to miscarriage, preterm, and death of both mother and baby. This finding has surprised me. I never knew it affected pregnant women that much. And that leads to fleas. Fleas plays an essential role in the bubonic plague. First, I'm going to talk about the background knowledge of fleas. Adult fleas were a kind of external parasites. They parasite on mammals and birds as their host. They live on skin, fur, feathers, and feeding on the blood of their host. Some fleas cause harm to domestic animals, some fleas cause discomfort to humans, and some fleas were the vector of disease. For example, the rat fleas Xanthopsila chiopus is the vector of the bubonic plague. Biology within fleas. So how do fleas infect humans? First, the fleas take a large amount of bacteria from an infected rat. Then the bacteria move into the stomach of the flea. Since the bacteria white pestis glues the spine together and blocks the valve, the blood flea stock cannot get into the stomach. And when the pharyngeal pump stops, the swollen esophagus will retract and drive blood back into the wound. The bacteria enter the bitten host's bloodstream, which causes infection. Biology within human body. When flea injected white pestis in human, the lymphatic system was affected. The lymphatic system is a significant component of body's immune system. The leukocytes can kill most of the bacteria, but it cannot kill all the bacteria, which white pestis spread through the lymphatic nodes. Then the bacteria replicate, which causes the lymph nodes to swell, which create buboes. Finally, the treatment for bubonic plague. There wasn't a vaccine for bubonic plague yet. The treatment for now were antibiotics. The technique of antibiotics is trying to block bacterial process and kill or stop them from multiplying, so the immune system in human body can fight back the bacterial infection. The treatment targets includes the bacterial cell walls and membrane, DNA and RNA, and the machinery that produce protein. The steps of making an antibiotic were very complicated. Step 1. Basic research. The process of finding or designing a new molecule that could become a usable drug. Step 2. Discovery research. Step 3. Development. Step 4. Delivery. The last 3 tested safe and a current drug, so the medicine can use to treat the bacterial infection without harming the people who use it. The antibiotic helps scientists to develop a new molecule which can cure the bacterial infection. It benefits the community by killing the disease without spreading like wildfire. The antibiotics used to cure bubonic plague were ciprofloxacin, gentamicin, doxycycline, levofloxacin, and moxifloxacin. First, I'm going to talk about ciprofloxacin and levofloxacin. They were both from the same group, which called fluoroquinolone, used to treat bacterial infection and have side effects. Next, I'm going to talk about moxifloxacin and gentamicin. They were both used to prevent plague and treat bacterial infection, and both have side effects. Moxifloxacin were from a group called quinolone, and gentamicin were from a group called aminoglycoside. Last but not least, doxycycline. Doxycycline were from a group called tetracycline and used to treat bacterial infection, and also have side effects. Future of antibiotic. It follows by a few questions. First question, what are the challenges? The challenges of antibiotic were the antibiotic resistance. Antibiotic resistance occurs when bacteria develop the ability to defeat the drug designed to kill them, resulting in a still infected state. Antibiotic resistance also could lead to higher medical costs, prolonged hospital stay, and increased death rate. Second question, what strategy may improve the treatment? The perspective on current and future strategy includes vaccine and antibody therapy in animal model of plague. Third question, what is the future of antibiotic? The future of antibiotic technique needs to be focused on the problem of antibiotic resistance. It could be a big problem if such defects continue. Last question, what are the potential negative consequences of antibiotics? The negative consequences of antibiotic were antibiotic resistance and side effects. In addition, the bacteria could get stronger and stronger, which become more deadly, and it might kill more people. Last, how to avoid infections. There are a few tips follows it. First tip, clean environment. Eliminate nesting place for rodents. Second, avoid touching dead animals. Third, wear gloves when handling infected animals. Fourth, use repellent if you think you might expose to rodent fleas during activity. Fifth, keep fleas off of your pet. Last, do not let your pet sleep on your bed. Even though pets were lovely and cute, but there's still risk of infection. This is my primary source, works cited. This is my secondary source, works cited. Thank you for listening.